Hello everyone, my name's Astrid.
I'm Maria.
And I'm Navi, and today we'll be talking about transfusion crossmatching.
Typing and cross-matches are performed before a transfusion takes place due to people having different blood types. A person's blood group is denoted by a letter and whether their blood is Rh positive or Rh negative. The letters are decided by the presence of different antigens on the surface of your red blood cells and the different naturally occurring antibodies that correspond with those antigens. As you can see in this table, a person with type A blood has A antigens on the surface of their red blood cells and anti-B antibodies within their plasma. Each blood type has a different combination of antigen and antibodies. These combinations decide how the body will react to other blood types after a transfusion. Typing is used to identify the main ABO and Rh blood groups. In addition to these, there are 34 other identified systems. There are also many other types of antigens that can make transfusion blood incompatible. These are tested for in a cross-match by mixing the transfusion patient's serum with the donor's red blood cells and then viewing this under a microscope. If they are incompatible, a reaction will be seen and the donor red blood cells will clump together. Due to this, accurate cross-matches must be performed before every transfusion. Sometimes mistakes are made. Here we have a nurse about to take blood from a person he thinks is the correct transfusion patient. Unfortunately, the correct patient is in the next room, and although they have the same first name, this does not mean they have the same blood type. Pre-analytical errors such as these can have severe consequences for patients.
According to the Australian Red Cross Blood Service, these are the percentages of blood groups in Australia. As you can see, not everyone has the same blood type, and the chances of you getting matching blood without an accurate cross-match could be very low depending on what blood type you are. This means serious consequences may occur if the mistake we witnessed earlier was not identified and incompatible donor blood was used for the patient's transfusion. This can initiate harmful reactions as soon as the patient's immune system detects the donor's antigens and mounts an immune response to attack the foreign material within the bloodstream. According to information from the Royal Children's Hospital, a reaction to the donor's blood could be identified almost immediately after the transfusion by the following symptoms: fever, chills, hypo or hypertension, pain, acute respiratory distress, dark urine, bleeding, and high. If these symptoms occur after an inaccurate cross-match, there are 3 short-term conditions the patient may be experiencing. 1. An anaphylactic reaction due to a deficiency in immunoglobulin A and anti-immunoglobulin A antibodies. 2. An acute hemolytic reaction due to the wrong ABO blood type being used. And 3. A transfusion-related acute lung injury due to the patient's white cell antigens reacting negatively to donor antibodies. In all of these, the patient's prognosis depends on how quickly the negative reaction is identified. The possibility of death due to these complications is very real. For this reason, strict guidelines for all stages of the cross-matching procedure are in place as preventative measures.
Accurate patient identification is the key step to prevent this pre-analytical error for a cross-match. It can be argued that patient identification through all stages is the most important part of a blood sample collection. To correctly identify the patient before the collection, the phlebotomist should have verbally checked and confirmed the patient's identity, if they are conscious and lucid. To do this, the patient should be asked to state and spell their full name and date of birth against what is written on their hospital wristband and the blood draw request form. Similarly, their patient number should have been verified. If the details do not match, the blood sample should not be taken until they are rectified. Remedial action will vary depending on when the mistake is identified. If this pre-analytical variation is detected prior to the transfusion, then the correct patient needs to be identified and a new cross-match performed with the correct bloods. If the error is discovered after the transfusion has taken place, then the proper medical treatment will need to be administered depending upon the patient's reaction to the donor's blood. Also, a new accurate transfusion will most likely need to occur. Correctly identifying the patient for the pre-transfusion sample is an easy procedure that significantly lowers the risk of a wrong blood episode,
and therefore reduces the risk of a potentially fatal outcome for transfusion patients.
This is why there are strict guidelines in place when taking blood from any patient, and they should be closely followed by all medical professionals.